Hello, I'm Chris Cook. I'm one of the partners here and editors here at Tortoise, and I'm going to be leading today's ThinkIn. If you've not been to one of these before, don't worry, they're fairly straightforward. But the big idea is really that we as journalists know an awful lot about typesetting. We don't know a lot about the rest of the world. And what we want to do is get you to talk to us about what we should be thinking about. So the idea of this is not question time. We don't want to turn into a panel discussion. We have a loosely enforced rule that we don't allow questions, although it is slightly loosely enforced. The idea is we want to hear your contributions and your thoughts on these things. You can, if you want to contribute to the conversation on video, if you look in your in Zoom, if you click on the participants tab, you can then find a raise hand button, and that will notify me that you'd like to speak. I should point out you are automatically muted when you join, and we sort of prompt to unmute you. The idea is obviously to stop us hearing each other's radios and all that sort of thing. I'd also point out there's a chat in the one side, which a text chat. Ellie Jacobs, my colleague, is going to be curating that and perhaps sort of nudging some of you to speak up if she spots you saying something interesting. So there's a risk there, but do get stuck in. We will be recording this discussion so we can pull out bits and perhaps share them with other people. We may share that on digital platforms. I've got some, we've got some experts to help us sort of make sure that we start off in a sane place. And I thought I'd start by asking Anita Charlesworth, who's from the Health Foundation, to begin really with just her thoughts on sort of what we know about how the state has performed in this pandemic. We're talking about, oh, sorry, it's not Ellie moderating chat. It's actually Liz Mosley, my colleague. Sorry, that was my fault. We've questioned this about, we've posed this question about whether the state is big enough. Actually, there's a broader set of questions about how you make a pandemic-proof state, right? It's not just about size, it's also about resilience and capacity, lots of sort of things you don't really talk about. And one of the questions is really how much should we be willing to pay and change the way we think about things? And I guess the starting point really, Anita, is what do we know about how well equipped the state was for this disaster that in principle was the #1 risk that the government thought it might face?
Yeah. And so, you know, the thing when you start studying healthcare systems that you begin with is why do we have public healthcare systems or state funding of healthcare systems around the world? And one of the key reasons is to protect people against pandemic or major outbreaks of infectious disease, because that's a risk both to the individual, obviously, an uninsurable and unprotectable risk for the individual, but also it has all these wider societal impacts, which we're seeing to a great degree. So everybody else in my community and beyond's health has a really significant impact on my health and my well-being. So absolutely, this is what the system is there to do. And before the pandemic, actually, I was pretty worried, because after years of quite constrained healthcare funding, we went into this running our healthcare system really hot. So we've got fewer hospital beds than most other European countries. We've got fewer doctors per population, fewer nurses. We had very high waiting times. The system just looked really at the cusp of capacity. And that's not how you want to go into a pandemic at all. And it looked like a worry. In fact, the NHS itself, I think in the beginning of this first wave, has done remarkably well at redesigning a lot of the way it delivers care. So anyone that's needed a GP over the last 2 months will have seen it's moved almost entirely to a telephone first based system, and been able to operate. NHS 111 has stepped into the breach. We've cancelled all planned care and been able to free up a huge amount of capacity and our intensive care facilities have not been overwhelmed, which is remarkable. But some of that has longer term consequences, which are really concerning. So we've obviously all very focused on deaths from COVID, but I think we're increasingly worried now about, are there groups of people who've not been getting care for things like cancer that are really important, and we'll see almost like a second hit on mortality from some of the things that we had to do to meet the direct burden of COVID. The other thing that I think when there comes to be an inquiry we'll really look at is some of what the NHS did to create that capacity was discharge people from hospital really quickly. It did that without testing them. Many of them went into care homes, and then we get the care home outbreak. Now the care home outbreak probably is caused by a range of things, but actually, you know, there will be, I think, serious need to look at, did discharging so many people from hospital without testing them into care homes contribute to that? And whilst the NHS directly might have done well, it has shown two really significant weaknesses in our system. One is our infrastructure for public health. So undoubtedly, we've really struggled, obviously, with testing. And our public health infrastructure is really important for that. And basic things that people are reporting, like the Department of Health doesn't have a list now of the email addresses of every local director of public health. I mean, how can that be? As we've, with the Lansley reforms, decentralised and fragmented our system, the whole PPE saga, and which partly reflects as well that over the last few years we've really pushed all the focus on frontline, and we've cut everything that wasn't frontline really to the bone. So having things like good supplies, services, were just no one's priority. And then the travesty in social care, which undoubtedly, you know, when we come to the end of this, will be one of the biggest things that we need to look at, which I think, you know, is partly the nature of this virus. Obviously, it does affect the elderly and those with long-term chronic conditions, and almost by definition, people who rely on social care are the most vulnerable. But some of the things like our staffing model that led us to have huge vacancies in social care, really high turnover, people then, as we went into this with these really high vacancies, not being able to be tested, staff off, having to then parachute in new staff from all over, moving around and transmitting potentially while they couldn't get tested. All of these issues look really difficult. And also I think the NHS led the response to this. The NHS is a highly centralised system. We've got a couple of hundred hospitals that we had to mobilise and organise around. Social care is fundamentally different. You know, it's tens of thousands of settings and providers across the country, lots of them really small, and we tried to deliver solutions that worked in a big centralised NHS and a highly structured clinical environment into the really different context of social care. And many of those solutions, like these big industrial scale testing facilities you had to drive to, just don't work in that context. And you worry a lot, where was the social care voice in the room when decisions were being made? And was it strong enough? Was this almost too hospital centric for understandable reasons? Were people really worried about ICU because they saw what was going on in Italy and weren't able to think broadly enough about the full range of services that we would need?
So I mean, the dots to join there, Anita, are partly that. So I mean, local government runs both the public health infrastructure and social care, and you know, there may not be a coincidence that the extent to which local government's being massacred has been a part of the underlying. Yeah. I've done 2 think-ins recently with librarians, which might seem a slightly strange diversion to go on, but librarians have all been pulled out of the libraries, obviously, because they can't work, right? The libraries are shut. And actually they are public servants who know how to deal with the public and are really efficient and effective administrators. So they've been redeployed incredibly urgently and with enormous effectiveness into the rest of the local government, because they have this remarkable skill set. It's sort of, it never occurred to me that a source of resilience, we've cut so thin that the libraries are a source of operational resilience.
Yeah.
I wonder if we could come to Lawrence now, actually, to talk. So Lawrence has written this remarkable, I'm not going to call it, Lawrence is a former panelist in the Chilcot inquiry. He's a man who knows about how to spend a long time on something. But he's just written this remarkable 15,000 word opus on our first responses. I wonder, Lawrence, when you're thinking about the sort of the extent to which the die was already cast, what your sort of big conclusions are about the way that we ran our state dooming us, if you like, or cutting off our options.
I mean, I can't add an awful lot to what Anita just said in terms of the way the health service was organised. I think there's also just a question of political priorities. What interests me in a lot of this is that a lot of people are looking back to the exercise signet and so on, which showed how the flaws and the problems of stocks and PPE and so on in preparations for a pandemic. The main lesson that we learned from the last two, not the last two pandemics, but the two that are most similar to this one, SARS in 2003 and swine flu in 2009, is it probably wasn't going to be too bad. The importance of SARS was that it stayed largely confined to East Asia. It got to Canada. The importance of swine flu was that people thought it was a bit of a damp squib. Everybody had been told to get anxious and urgent and moved into emergency mode, and not a lot happened. It wasn't that different in the end from seasonal flu. So if you look at the government responses to that led to the plan, which was largely focused on influenza rather than more different sorts of viruses. If you look at that, there's actually an explicit statement that maybe we worry too much about the big things and not too much about the more likely things. So I think that this is always going to be a problem with learning from inquiries. It's like you may end up fighting the last pandemic. And indeed, one of the outcomes of that was a criticism of WHO for calling the pandemic too early. So, this time around, of course, they're criticised for calling it too late. So I think the mindsets with which people approach this are really important. If you're in East Asia, you remember SARS as being a really bad thing for which you have to make preparation. And as soon as you see the signs of something coming up, you swing into action. Whereas if you look at and we had a pretty good, I think SAGE is a pretty good system. I don't think, it gets criticized at the moment, and I think you can question some of the conclusions that came out of it. But as a system, it's not bad at all in terms of mobilizing scientific advice and giving it focus and ensuring its input into government. I wouldn't particularly, I think, sometimes you just have to look at it and say it's not a process. They made judgments and they weren't always correct. So the system is the problem was that they thought they had time. They looked at what was going on. They listened to WHO. They looked at the Americans and Trump being continually reassuring. They looked at the Chinese being reassuring. And the only people who were getting watching were the Taiwanese and the Singaporeans and the South Koreans and Hong Kongese, because they knew what was going to be like. But we thought we had more time, which is why Italy in the end played such a big role in changing our attitudes and changing the models. So in terms of the processes, they work quite well. We drew lessons from the last big pandemic, and we decided we could probably cope. We watched what was going on this time, and we thought we had more time, and then we thought we could control it more. So one of the criticisms I think you could make is a belief that you can control responses to something like this. I mean, what's so fascinating from the sort of the speed of the British government's shift from being relatively relaxed to throwing everything at it almost, was, I think, this sort of idea that there's a tailored, clever, graduated response to something like this, which if you implement it carefully, then you can slow the curve to suit you, and you can push it to into the summer so it won't be so bad, but you'll have a influence on the second spike that needs to be more manageable. When actually you couldn't. We didn't have enough knowledge or understanding of what was going on to take that sort of view. And that's why in the end, it wasn't government advisors, particularly the government, that pushed policy. It was public. Public saw what was going on elsewhere. They saw the French and the Irish and the Germans were doing different things, and they wondered why we weren't doing all of those things. So there was a sudden jerky movement to sort of almost to follow public opinion. And then, of course, the imperial study came in and said, actually, you don't have as much time as you think you had. You've got to move much more quickly on that. And then we did.
Was there anything where, when you were reading over the documents, where you thought, I'm amazed we don't have X or Y or Z, or, oh my Lord, is it really the case that person A or B or C really has responsibility for that? Is there anything you sort of, when you looked at the structures, where you thought, this strikes me as completely nuts?
No, I mean, I think if you read, I mean, I've read an awful lot of the of the stuff now, and not just the documents that are, I mean, to go again, to the credit of everybody, are on the website, so you can read a lot of the inputs into SAGE, but also a lot of the scientific papers that these people were producing. It's perfectly reasonable. It's good stuff, a lot of it. The issue isn't that they're saying it won't hit. Nobody's ever saying that. They think there's more time. Another issue, I think, that strikes you in retrospect is a number of saying, actually, if you're going to intervene with what they initially called non-pharmaceutical measures, don't talk behavioral measures, if you're going to intervene, actually it's best if you throw everything at it. These things are not as effective individually. Yet somehow, and I don't think, this is where it'd be interesting to see the actual SAGE minutes, because we haven't seen those yet. Somehow this idea got hold that you couldn't do that you had to introduce these things, or you had time to introduce these things more gradually. So, looking back, it's a lot of the stuff's quite impressive. It's not what's missing, and this goes back to Anita's point, is any consideration of social care.
Right.
You just don't see it. The focus, the target is hospitals from the start. And that was partly from the Italian experience. But it was known that this disease would disproportionately hit old people. I mean, that was clear from China. So a lot of the stuff that we now realize was known, was being talked about. The main thing that they since got wrong, or they took it from China, how reliable was the Chinese information, was that the doubling rate would be slower than it turned out to be. I mean, and it's not, again, like a lot of these things, it's not that they were seriously in error or irresponsible. It's just, it's difficult to get these things right, and they got it wrong. Or at the time that seemed right, and then it turned out, as they looked at Italy, no, it was going to be worse than that.
Right, thank you. Jill, can I ask, so Jill's a fellow at King's and at the Institute for Government, and I think it's important you understand that Jill as a career civil servant came from a particular tribe, and that she will forever have the words HM Treasury written through her like a stick of rock. And the Jill, what was the sort of, can I ask about your sort of reflections on sort of resilience and capacity? And as you watch what's unfolding around us, whether you think that the government in general has taken the problems that we've seen seriously enough?
I'm going to point out at the start that Anita is similarly an ex-Treasury person. So if that applies to me, it certainly applies to her as well. So I think a few points just to make. I think on this issue of investment in resilience, government finds anything that isn't investment in current services quite difficult, particularly at a time when public spending is under pressure. Because the question is always, if you're investing in something like resilience, you're basically paying an insurance premium against a possibility, and you don't know quite what that possibility will be. I used to be at DEFRA, we were always making the case that we had to spend a lot more than the government was prepared to spend on floods capital in order to protect against flooding. But even when we improve flood defences somewhere, the flooding would be somewhere else. So one of the problems is you can invest quite a lot, but you're not actually investing in a way that helps you with whatever problem strikes. So it's quite difficult to make the case for resilient spending. And that is particularly when you have a period, as we had from 2010 to 2020, of prolonged austerity, when you've been pressing down on public spending, which means that there is ever more need, as Anita was saying, to divert money from anything sort of back of house, anything that's not perceived immediately by the public, into the front line. And that doesn't just apply to resilience, it also applies critically to things like spending on prevention. And one of the things I think we've seen in the coronavirus crisis is actually it's a very differential effect depending on your sort of pre-existing health status. So actually, you know, the toll of coronavirus has been much greater on people who are already suffering from underlying sort of health inequalities, as Michael Marmot might say. So, and that's another area we've cut back. I think one of the things that's been striking me in this conversation is that, I mean, there's definitely a sort of sense, and I think Lawrence Freedman was talking about it, that you do if you spend and you know, but if you spend, you can also be damned. Because I was in government, you know, when swine flu hit, and certainly there's a lot of criticism of government. You know, we spent so much money stocking up on Tamiflu. I think that's a bit of a scandal in France. You overspend on the wrong things, and people don't actually thank you for spending in that way. It's, well, that could have bought us more nurses, more whatever. So government is slightly damned if it does and damned if it doesn't. I think one of the things that's really interesting was I followed some of the debates, not as closely as Anita, on the Lansley bill when it was going through. And it's really interesting, that was a major set of institutional shake-ups, hugely opposed by the medical profession in many ways. But I don't remember anyone really tackling the issue of, would this leave us less well able to respond to a pandemic? I don't remember that sort of public health stuff mattering. I want to make one further comment on public health is also always a bit of a Cinderella, even though it's a thing that affects the sort of greatest health of the greatest numbers compared to acute care in hospitals. And I think it's a real problem. Anita made the comment, why was there no one at the table arguing for social care? There was a person called the Secretary of State for Health and Social Care at the table, but there is a problem that the absolute primacy that this country gives to the NHS, and within that to hospitals, excludes all other forms of care and basically devalues everything else. And Matt Hancock, you know, he didn't have the slogan of protect the NHS and social care. He had the slogan of protecting the NHS and social care. And when, you know, Sir Lawrence gets to chair the public inquiry, I think one of the big questions will be, did protecting the NHS actually mean protecting the NHS at the expense of social care?
Right. I think that's I think at the time, during the Lansley stuff, there was this whole thing about whether the Secretary of State would have the authority to intervene in a crisis. There was this sort of, Andy Burnham made a big thing about, based on the experience of swine flu, that you need to have the legal powers and the framework to be able to do things. But actually, I think in practice, there's not been a problem with that. They've been able to just do what they want. And it's just been Simon Stevens has had to countersign it all. So I'm not sure that's not turned out to be the issue. It turned out, I think, to be all the public health stuff, which is, you know, devolved even one layer down from that. Can I come to Tarek Sholi? Tarek has made
Good afternoon.
Tarek, you made a really good point in the comments, which echoes
Did I?
what you're saying. About
I mean the social care. Yeah, I had a different question, but the social care for me, my wife's a doctor. GPs and nurses have got this great voice in media, and in politics as well, and it's just absent in social care. The people don't have the voice. They don't appear on fundraising things. It's chalk and cheese. The clout that they have, the British Medical Association, the nursing union, they have sort of great advocacy, which just doesn't seem to appear. I had a question, maybe for the few people that have spoken, and it's, was the speed and the effectiveness decision making sound at the government level? Some of the levers, we talked about investment and resilience, but a lot of what seemed to be going wrong was maybe the speed as well as the quality of decision making. Some of the levers that seemed to be on the table that were free or low cost, some sort of scanning for fevers at the airports, or some of the measures that have come in the last couple of weeks seems to have come far too late. Was there a tension between the political process or the sort of technical process that led to this slowness in response? And we've talked about sort of resilience as well. I mean, I've come from a sort of business background where resilience plans are there, and they really are IT plans in a way. But it seems strange, and it's with perfect hindsight, that this government has been very good at passing on a lot of responsibility to business. But this idea of resilience around pandemics, it doesn't seem to have much to say to the airports or to the community at large. And this is all thinking stuff. It's not sort of necessarily big investment programs.
The sort of guidance for sort of how you should move on.
Yeah.
Right. Okay. Look, so obviously the questions are banned, but we will come to your thoughts.
Oh, sorry. I missed that bit.
We'll find a way around it. I wonder if we can come to Paul Tyndall. Paul is a regular at our in-person ThinkIns, and I'm delighted to see him joining us here. Paul.
Nice to see you, Chris. Yes, thanks for thanks for hosting this and continuing. I mean, I think when we've spoken in the past, Chris, you've described me as a classical liberal, which I think is quite a rare creation, or libertarian or whatever. So my instinct with the title of this ThinkIn is to immediately say, no, government's already too big. I want less government, roll government back, etc., 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 because that's my natural starting point. And whenever I vote in an election, my vote is for who's going to do least. That is always my sort of starting point. But going into this and looking at where we've got to, I don't know if it's a question of scale or whether government needs to be bigger. For me, it's a question of quality, and it's a question of competence, and it's a question of capability. And I do wonder whether actually we have a problem in that the government has got, and I mean government in the big, broad sense here, the civil service, the NHS, etc., all aspects of the public sector, have they become distracted by smaller issues? I could name any number of them, but I'm sure people are quite aware of them. Smaller issues, rather than thinking about the really big picture stuff, which is the core capability of government. So for me, looking at this pandemic and looking at the responses of government, my instinct is not for more, but for better, for a higher quality of person in government, a higher quality of thinking, a higher quality of research. And yes, maybe the more, it means I have to pay for that. Maybe that does mean I need to pay more tax money to actually get a higher quality. But I don't want to expand the scale of government. I want to expand the quality of what the government does. Yeah, and as George says on the chat there, higher salaries for MPs, absolutely. They're massively underpaid. We should be attracting high quality talent in, and it's that sort of thing that I think we need to bring through. And it's at all levels. I look at civil service jobs and what we pay in the civil service. It's significantly below business benchmarks, and therefore you're going to always lose the quality of person who may come into the public sector. So Is it a quality discussion or a size discussion? I know that's a question, but I think that's where I stand at the moment.
I think the problem isn't the problem, Paul, that everyone really wants. If we can have higher quality without spending more, you know,
Yeah, but I think the subtlety there, Chris, is perhaps, you know, for someone like myself in a position where my default is I don't want to spend money on government, actually, I'm more willing to spend money on quality than I am on extent. So if the argument is that I need to pay more income tax because that's going to lead to a higher quality of government, I will absolutely subscribe to that. If I pay more income tax and that leads to the government interfering in all aspects of my life or more aspects of my life, then absolutely no. But if they put forward a quality argument, I will, you know, I would probably stand here today and say that if that requires me to contribute more, I will. But if it's an extent, no, I won't.
Isn't there? There's a problem here, though, isn't there? That I've written a sort of little thing ahead of this about some of this stuff. One of the questions is about, for example, pandemic preparedness is partly about, say, housing policy, right? So it's about part of the reason we've probably got a higher transmission rate than some other places, say Sweden, is, or you know, in like for like circumstances, is because we put more people in each house, we run houses hotter, we run everything hotter, we have less slack in it. So a house building program is a reasonable response to a post-pandemic, of a post-pandemic state. Spending more on social care so that we have higher quality and more people getting social care, and so that we can, that's a response. Yeah. I feel like these are things that you would normally push against, Paul.
I think I would. The house one is really interesting. I pondered on that when I read the notes, because one of our problems is we've gradually reduced room sizes in housing design for new builds over the successive years. The average size of room has gone down, density has gone up. And actually the consequence of that is pretty unpleasant housing arrangements across both the public sector and the private sector. Plus we haven't spent money on social housing, which is a part of the housing structure that we need. So I'm not averse to from a purely personal point of view, I'm not averse to these levels of government involvement, but I think the quality of decision making has to be higher. And some of the points that are being made on the notes on the chat, I don't have a brilliant answer to how you achieve that or how you attract it in, but I think that narrative of looking towards a more competent government rather than a larger one is a reasonable argument to start from.
Okay, can we come to Oliver Bush? He's had his hand up for a while, I should confess.
Yeah, thanks, Chris. So I just had a couple of points to make. So the first is, I think there's a bit of a danger in this conversation that I'm sure is going to continue, going to run, that we focus too much just on government spending, whereas actually, a big part of the role of government is regulation. And this is incredibly important right now, because Brexit, assuming it goes ahead, will give politicians a much freer hand in the role of regulation. And the public understanding of these issues, I think, is very poor. But it turns out that some of them are really important. And so that brings me on to the next point about the role of journalists. So I think a big problem is in this debate ahead is that we, as the public, we're just very poorly informed about what the government does and does not do at the moment. And having a better understanding of that seems critical to me in terms of understanding and having a good debate about what the government should and should not do. And in the years following 2010, I think it was a big problem that we knew all those cuts were happening, but we weren't told enough about, well, what is it actually that we're losing out on? And what actually, who is it who's bearing these costs? So it seems to me it's really, really important, especially now that journalists report on these issues, combination of Brexit and the fact that we're going to have very high debt GDP ratio, so many more calls for austerity. And so I just want to finish by saying a couple of things that kind of illustrate what I have in mind. So firstly, Michael Lewis's book, The Fifth Risk, I just found really, really eye-opening in terms of a description of some of the things that the US government does. I just had no idea, and I think that's really revealing that we have so little understanding of some things government does. And then the other is Chris's report, your reporting on fire safety standards. Now, if we could have that kind of thing, but ex ante, not ex post, then that would be really great to have. Thanks.
I wrote a piece on, that's very kind. I wrote a piece on furniture fire safety, which people are less interested by. but one day, if there's a fire involving furniture, people will finally read it. That's the fundamental problem, is that regulation is quite hard to report on. But I think you can assume that everyone who works at Tortoise has in their heart a critique of British journalism that they brought with them. Can I come to Gwen Swinburne? Gwen? Hello? No? Oh, I think made a point and gone. Oh no, there you are. You don't have to turn on the voice. Okay, well, work that out. In the meantime, I don't know if I could come to Giles Wilkes, who I can see is loitering. Giles is a former, is a quite cool character, and having basically joined government as a Liberal Democrat and managed to stay until about 6 weeks ago, as far as I can tell, advising everyone.
Can I correct that? And by the way, I was just about to make fish cake, so I feel somewhat ambushed. But by all means, turn to me though. I would like to say I had 2 years out being a rather worse journalist than you, Chris, before returning to Theresa May's Downing Street to try to do a bit of industrial strategy.
I just wonder, Giles, and you've fought with the Treasury to try and build industrial strategy for years and years. I mean, when you look at what's going on at the moment, do you have any confidence that about, do you have any, what are your priors about where a likely argument is going to go to?
In terms of future industrial strategy?
In terms of future strategy for the state? In terms of,
yeah, I mean, I think I'm so mesmerized by the size of the short-term deficit, to be honest with you, that it's very difficult to see, unless you've got the most incredible cyclical bounce back, and it turns out that 280 billion of the 300 billion is in fact cyclical, and the rest is easy to deal with. That's going to dominate them for a very long time. And that, I mean, who remembers what John Major's long-term industrial plans were in 1993, or even the fantastic Lord Mandelson's New Industry, New Jobs in 2009? When you've got a £150 billion deficit, mostly all you can produce is Word documents turned into PDF documents. So I should think it's going to be, the obsession is going to be about that, particularly as so much of what they might have cut has already been cut. So in terms of a longer term strategy towards the state, well, we all know that Boris Johnson is a much bigger fan of public spending. This kind of, he's in that quadrant of being sort of socially conservative but economically left wing. He wouldn't have any problem at all with spending lots of money. I think they're going to have to raise far more taxes though, and he hasn't proposed anything that's remotely unpopular. So I don't think he can have a well-funded industrial strategy as things stand, and trying to do it at the same time as Brexit, when so much of what industrial strategy means, half of the people who think about it in terms of physical goods, and they need to move over borders, and that's probably not going to go all that well in the next few years if they go ahead with this particular kind of Brexit. They might find that they just don't have the normal recourse of like talking to aerospace and autos and chemicals and saying, what would you like? Because we all know what they would like. So I don't pick up from within government a strong sense that they have a really positive plan, apart from this fascination with R&D, which I mean, you must have read the same very, very long blogs by the chief advisor, Dominic Cummings. They all seem to be premised on us recreating the conditions that were there in post-war Britain and or post-war America, more like moon missions and Manhattan projects and that kind of thing. And they don't, I mean, I can't see a modern sort of version of that that can be cut and paste, but he might be hoping that somehow you can put a small amount of R&D money in and produce a giant industry off it, like, all the obsession with Xerox PARC and creating the internet. But that, I mean, there's no sense I get that they actually know how to run that forwards rather than backwards.
Right. Thank you very much. I'll let you get back to your fish cakes. Thank
you.
It's Alison Stancliffe, who is writing about local authority.
Yes.
Hello.
Okay, where am I? Hi.
Hello.
Hello there. Hi. I was hoping not to be seen, to be quite frank. Here I am. Yes. Hello, and you can hear me too.
And So
Yeah.
local government, you think it should be being coordinated, but it should be running the show?
I don't think it's running. It should be running the show. But I live up in Tyneside. First, I lived in Gateshead, then Newcastle, and you can imagine. Actually, doesn't take a lot to imagine if you know anything about it, about the decimation of local services here. And it's not just that; it's a decimation of local knowledge and local expertise. It's just mind blowing. And Alison Pollock, I've been pushing her. She's this great professor who has actually nailed what's been happening within this epidemic in terms of how much better we could have coped, how we could still cope actually with testing if we went local rather than centralized. And I think this is somehow, it's like no one's thinking about local government, and yet it's such an important way to change our society again. And so I just want to say, come on, we need to be thinking about this more clearly and not leaving it lying in a dust heap somewhere.
Okay, I mean, I might come back to Sir Lawrence from Tyneside to our expert Geordie.
I'm a Geordie, yes.
I just that there are a few things that sort of cropped up. One of the things about local government is it's a sort of catch-all, and it provides a sort of generic resilience to government. When government doesn't know what to do, it's local government that sort of takes on the frame. And I just wonder if you have any thoughts about sort of about the role of resilience and how we should think about these things. One of the things that jumped out one of the things that's most striking, one of the many things that's striking in the Chilcot report, is the fact that the firefighters' strike almost caused us to have to not to take part because we needed the firefighters at home, the army at home, to deal with that. The ability of the state to do multiple things at once, I think, has been enormously undermined by the reduction in local government.
Yeah, I mean, this goes back to Thatcher years, doesn't it? I mean, there's been a steady, and it carried on under Blair. I mean, there's been a reluctance of central government to devolve to local government, cuts of local government funding, and I mean, you can't rely on all local governments to be good and effective. But I think there's quite a bit of evidence when we do the comparative studies of the responses to COVID-19 that, and this is one thing that's argued, for example, with Germany, is that the strength of local systems there has made quite a bit of difference in getting an effective response. So I think that's one part of future resilience, is that central government just gets overwhelmed in something like this. There's just too much to do, and you need to pass it on. And there's all sorts of stories coming on now about testing, about the problems of coordinating the information coming in and so on. So I think that again, I mean, basically what we keep on saying is that all the things that have become rather marginalized because priority is being given to the big item central systems that people noticed and seem to be most important, all those things that have become marginalized all of a sudden become really important, and when you look for them, they're just not there in sufficient numbers. Can I just make one other point that's also struck me? I mean, you can argue that one of the impressive things about the last few weeks, months, is this sort of sense of national effort and how people are prepared to be mobilized, volunteers, getting quite excited. I mean, we may not have needed the hospitals in the end, but people got quite excited by the way they were being put together and so on, mobilizing industry on special tasks. This sort of sense of national mobilization is a feature of emergencies. It can't happen all the time, but it's an interesting aspect of what goes on. And it's a different sort of model to one where we might sort of just imagine the state has to provide everything. You can still have to work with companies and markets and so on. So I think that's one thing. The other thing is we haven't really mentioned the international dimension of the problem. I mean, one of the reasons we got caught out, and everybody got caught out on PPE, there's very few countries that at the height of their crisis didn't find shortages here. But one of the problems is we depended on external suppliers. And you can see, again, in a lot of the commentary that's been going on about what does this all mean, that sort of a reversal of globalization is going to be another feature. If you want to be resilient, then maybe you can't depend so much as before on external suppliers, either because they may wish you ill, which has always been one argument, but simply because they have their own priorities and their own needs. And it's a competitive market. If you look at some of the things that were happening with PPE stocks, not particularly involving us in mid-March, there was almost piracy going on as one government took away stocks from another by just outbidding them. So I think that's another thing. What all we're seeing is that when it comes to a crisis like this, trends that we thought were pretty solidly established, which marginalized some things, centralized others, all of a sudden seem not to be quite such a good idea. And having got used to a very different way of operating over the last 6-7 weeks, which is going to go on for some time now, it'll be interesting to see how much we can hold on, or we'll sort of learn. For the part of resilience may be a much more autarkic economy, which is what every sensible economist has argued against since the time of Smith and Ricardo.
I think we're talking earlier about we've talked several times before now about the Australian bushfires.
Yeah.
Because they were a national mission problem dealt with by a combination of a volunteer force, professional army providing sort of underpinning logistics. And I wonder whether when we're thinking about future planning, should we think more about, well, soldiers are more valuable to us than Trident because we can deploy soldiers against flood.
Well, I think one of the things, we talked about this before, I think one of the things, you mentioned the green goddesses, but it goes back to foot and mouth and all sorts of things. If you need an organization that is organized, disciplined, has good logistics, plenty of people to move into a problem quickly, you tend to look to the army. I mean, it's what it's good at. We had it with flooding earlier this year. We've seen it working pretty effectively now, trying to distribute PPE. And that means, you just have to reimagine what the military is for. Hopefully less about killing people and preparing to do that. They have to have some residual capacity. But certainly having a pretty well organized, disciplined force that will go where it needs to go. And when you need people, you need lots of people working pretty quickly. They're there for you. And people have always had these sort of ideas about different forms of national service and so on that wouldn't just be about learning how to march and fight. Again, this is something that I think we could see coming out of this.
We had a civil defence corps for sort of 20 odd until we decided that we'll get blown away by any.
It didn't do an awful lot of good with a nuclear bomb on it.
We would be dead anyway. So, can I come to Anita, who I see has put her hand up?
Yeah. So I just thought I'd come back on 3 issues that were raised in the discussion that I think are really interesting. One is someone commented that some of the smaller countries around Europe seem to have done better, and people were talking a lot about the local versus national. And one of the things that the Lansley reforms did in England was to abolish a regional tier in the NHS. And I think one of the things that's quite difficult coming in the COVID experience with social care and local government is just the gap from central government to the fully local is very large. And without a strong, and we've had this permanent debate in the UK about a tier somewhere between local government and central government. I think it'd be very interesting to see if Devo in Manchester, Devo Mank, with Andy Burnham as well, had any impact at all. I mean, certainly at the moment, their mortality rates in the Northwest don't look fantastic, but that will be very interesting. But I think it will probably, the question of the role of a regional tier will probably come back, The other thing that's quite interesting on the regulatory field is to see the extent to which, with the state taking such a powerful role in our lives at the moment, I mean, the most controlling imaginable, will some of the things in public health that have always been labelled nanny state or beyond the boundaries of the state, is there a window of opportunity almost after this, which public health people are asking, to do more in that space, particularly if bearing in mind the massive and colossal deficit, some of the things that are about spending money look harder, and so regulating looks more attractive, and there's more public appetite for regulation. The third thing is, what does this do to our international migrations and our attitude to migration? I mean, universities are not expecting foreign students back in the same way, not for 1 year, they're just not, they're not. Will people feel the same way about moving around the world? So will the pressure of inward migration be lower? And conversely, we've relied on services, both public services and private services, that are very much staffed heavily by migrant population. So 1 in 4 ICU nurses is from overseas. Yeah. So will some of that migration debate, which has been so powerful in our narrative for at least a decade, will that change as a result of this?
Right. Do you think, I mean, if you could spend, say, 5 billion quid recurrent every year, Anita, spend it on right now?
So I'd spend it on, well, if I had 5 billion, it'd go on social care. You know, that's just for me a no-brainer.
Okay. And what's the
and straight to improving the quality of social care and the workforce, the support for the workforce.
Right. And what if I gave you another 5 billion after that, after we fixed social care?
After we fix social care, yeah, I'd put it into 3 things in the NHS. So the workforce, you know, we've been running on empty on the workforce, and actually once we get through the peak of the pandemic, we've got a massive backwash of issues, as waiting times have grown massively. You know, staff are very depleted. All those issues, we need to address that. Clearly needs some capital infrastructure, and that's not just buildings. So, you know, one of the things that made the pandemic so difficult is we were often flying blind on data, you know, and we've underinvested in things like information systems, which in the modern world are probably part of your national critical infrastructure for resilience. And then the other thing that will come out of this again is the burden of mental health that we see through this, and our underfunding of mental health services. Again, that will be vitally important. So that's where my money would go, I think.
I do think mental health is going to be a really interesting hinge at the end of all of this. There's it's a Cinderella service doesn't do it justice to how strained and starved it is. But it's also it's from my conversation with my peers, just the number of people who are finding this process of dislocation and isolation is, you know, is going to
and we're very aware that, and I don't want to play this as a pure intergenerational thing, but we are very aware obviously of the old people dying at the moment. But what all this period out of school, what the pressure on families are doing, all of that, what this will mean for children and young people, for a generation of young people. I mean, you know, this is going to have impacts for several years, whose whole experience of adolescence and into adulthood is profoundly transformed. And that will have very long-term consequences. And we're all very worried as well that people with existing mental health conditions are not accessing services as much as they should through this, and that will have deep consequences. So, it really worries me. It really worries me, this.
Can we come to Tom Westgarth, who is a young person himself? Tom, one of our... Hi, Tom.
Yeah. Hi, how's it going?
Good.
Yeah, no, I'm still young, but I'm feeling quite old. I've been watching Normal People recently, and you're definitely getting a bit of nostalgia for university years. But one of the things I really wanted to talk about, and I'm glad we're having this conversation about the role of the state, because I feel we need to articulate or find a new way of articulating the role of government, who it serves and what its purpose is. And maybe actually Paul might be interested in, you know, the sort of stuff that Marino Mazzucato says when, you know, talking about things like the entrepreneurial state. I know she's far from a classical liberal, but that might be something worth discussing. But the main thing I wanted to sort of try and get across is that there's a risk of thinking too much about the pandemic as a sort of singular public health thing and not about what it's part of, what I see as a sort of existential risk. And existential risks are things that really pose a threat to the long-term future of humanity. And this is something where I think the state really needs to sort of step up its game and trying to protect these serious threats that we're faced with, whether it's unaligned artificial intelligence, whether it's nuclear war, whether it's climate change. And these are, you know, problems that could really sort of prevent humanity from living for hundreds, if not sort of thousands of generations into the future. And that's something where I think we can afford to get away with spending a little bit of more money because, you know, just from sort of, if you want to look at it from expected utility theory, if you like, if we spend a bit more money there and yeah, it adds to the debt a little bit more and yeah, it's maybe not balancing the budget in the same way that people might ask for, but in the low probability that an event like, let's say, nuclear war happens or a sort of pandemic at an even greater scale than what we've seen at the moment, it's going to look like the best investment we've ever seen. So, I mean, that's why I'd like sort of us to have future conversations. And there's someone, I think he's at Oxford University called Toby Ord. He's sort of worth, I think if Tortoise could bring someone on to talk about this sort of stuff, he'd be the person I'd go to ask about that.
Cool. So, okay. I think we did spend quite a lot of money for quite a long time on trying to stop nuclear war, to be fair. I mean, yeah, it worked. It did. Can I come to Jill Rutter finally for just before as we wrap up? Jill, I mean, has there ever been a moment in your life when we've cared about prevention, social care, or local government?
Not as much as this, I have to say. So it's an opportunity. I think the really interesting question is where people are, not now, but when we're sort of through and approaching the sort of, you know, time when we can start making new sets of decisions. Do we really sort of remember this experience? And I thought it was quite interesting when you kept on offering Anita more and more billions. Anita was spending it all on the NHS, which we know has a sort of, she did spend the first 5 billion on social care, but then all on the NHS. I think it's a really interesting question about whether this, you know, gets us to a stage where we're prepared to sort of invest more in long-term resilience, whether we actually have a sort of ring-fenced budget that we say, actually, that's top sliced off every spending settlement, and we will have maybe some expert committee or something like that to say, what do we need to do to make sure we are resilient against the biggest threats? And that's not just the sort of, you know, the right sort of pandemic, it includes the wrong sort of pandemic. I think it's interesting, some of the comments on the chat about, do we invest in more capability in government, whether it's national or local, or do we perhaps sort of do things so that we have a better way of mobilizing sort of talent in these circumstances? It's very interesting where government's brought people in, it's had to bring in people like Paul Dayton, you know, as Lord's Minister, you know, appointed people in odd ways. Should we make it easier to bring people in when you need, you know, as they did in wartime, to bring in big talent into government, you know, just for a sort of emergency thing? The government, you know, racked up 750,000 volunteers, many of whom are now, I think, turning their apps off because they haven't been used. I mean, that seems to be a big sort of resource that was mobilized that's going to waste. So I think there's a really interesting question about how do we make sure that where we have done things differently, where we have sort of, you know, got attention, how do we hang on to that and not just, you know, sort of think, well, that was so 2020 and this is 2021. And I think Tom's question, can we apply this to other things, you know, and in particular, does it increase the appetite to deal with climate change or reduce it? I think it's one of the big coming questions. So it'd be a good one for another ThinkIn, Chris.
All right, Liz, note that down. I think one of we should, it's 7:31. If we'd been in our newsroom, the little tortoise would have made its way across the screen by now. I think one of the things that's, there's a sort of wrote today, actually, there's it's a bit nicer than buying insurance, what we're talking about, because you actually get something even if it doesn't pay out. on lots of these things. If you don't run the NHS so hot and people have more time, then it turns into better quality healthcare. It could lead to more innovation. We've tried this idea that you basically stop giving money to the NHS and hoping it will innovate its way out and improve efficiency without being able to spend money up front on new kit or new space. That doesn't really work for very long. As Anita says, we've sort of sweated the staff. I think to Sir Lawrence's point actually about the decisions as they were made were comprehensible. They were not, without necessarily being right, but the people were acting with the best available information at the time, and the problem was the information. I have a sort of growing, it sort of started for me with the Grenfell Tower response, the sudden realization that there were loads of things the state didn't know about, and I would just always assume the state would know about. And I have to say, pandemics are firmly in the box of things which I expect the state to be quietly getting on with, even while I'm looking somewhere else. I think I think we've got some really good points. I'm sorry to not come back to Alison, who's also pointing out in the chat that local government in Tyneside is taking matters into its own hands and starting to do its own testing. I think the ability of local government to respond to sort of generically to threats and concerns, its ability to just step in. The idea that you would hire someone as a librarian and then have them running crematoria, which is what they've been doing recently, is pretty remarkable. And it's there's a great advantage to having just people on hand to do things. I think I'd have to confess, I don't think we've got a good answer on what the post-pandemic state will look like. We've got a lot of worries. That's probably my fault, but I think we've agreed that what went before, even Paul Tyndall, even the redoubtable Paul Tyndall, accepted that maybe the state might need to be funded to be a higher quality enterprise. Something I think regulars may appreciate as something of a moment. But yes, so it's sorry, better not bigger, he says, better not bigger. It's something of an odd thing that we still don't really have an etiquette for ending these things. So I will write to you all with a sort of summary about what we've talked about, which is slightly less scattergun than that summary I just gave you. What we do is, to end this thing though, is we wave at our cameras so that we have a sense of finality. Thanks ever so much for your thoughts. These are all things that they're really helpful to us in working out what we think. But yes, thank you.